Hi everyone, welcome to today's webinar. I'm Thiviya, very excited to be the host of the show. Hope you're having an amazing day. And today we are speaking about its precision medicine, the future of healthcare. That's the topic that we are discussing today. The medical history of cancer began millennia ago, but this disease was predominantly treated with radical surgery and cautery that were less effective. For example, we had chemotherapy, surgery, and radiotherapy. These are the most common types of cancer treatments available nowadays. But what could be the future of cancer treatment? Could it be nanomedicine? Is it robotic surgery? Or perhaps precision medicine? What is actually precision medicine? As I know, it's been around for some time, but do we Malaysians really know how it's done and how precision medicine helps in treating cancer much more effectively? Right, we have three amazing panel joining us today to talk about this. But before I invite the speakers, just a few housekeeping rules to keep in mind. Kindly ask your questions in the chat box if you are viewing on Facebook, or you can ask it in the Q&A box if you are in Zoom, or anytime during the show. If you have any questions, just ask us. And you can also tag or share this live with your friends to gain some knowledge together as well. And if you'd like to share photos about today's event on your social media platforms, kindly do so. Will be much appreciated. Right, now to clear all our doubts in regards to precision medicine, like I mentioned, we have three amazing panelists. Let's welcome them today. Firstly, let's welcome Dr. Hajar Marlina, Head of Medical Management, PruBSN. Hi, Dr. Hajar.
Hi, Thiviya. Assalamualaikum and selamat sejahtera to all our viewers and also the lovely host today, Thiviya.
Thank you. How are you?
Fantastic. Thank you very much. How are you, Thiviya?
Good, very good. Looking forward to, hearing your insight.
Likewise.
Definitely. Right. So joining Dr. Hajar is none other than Dr. Muhammad Faiz, Head of Medical Support, PAMB.
Hello, everyone. Hi, Thiviya.
Hi, Dr. Faiz. I'm good, very good. Right. Hope you're having an amazing day.
Yeah. So in Prudential, we have some sort of a trademark that we reply to that question. So what we usually reply is that good, very good, excellent, oh yes. So
oh
that
yes.
is usually what we reply.
Right.
Energy among us lah. Yeah.
True. Right. And I think joining these amazing two speakers is Sayyidi Hamzi, Deputy Lab Director and Senior Clinical Scientist, Pantai Premier Pathology, Sendirian Berhad.
Hello.
Hi, Sayyidi.
Yeah. Hi, Thiviya. How are you?
I'm good. How are you?
Yeah, I'm very good, like Dr. Faiz mentioned just now. So it's good, double good.
Excellent.
Great.
Right. Now we have all three amazing panel with us today. Thank you so much for joining us, all three of you. And audience, if you have any questions about precision medicine or the topic that we are discussing, or any questions that we are discussing, anything that you like to ask the speakers, kindly put your questions in the Q&A box or the chat. They'll be happy to answer. That's why they are here. So we're going to have a great discussion about precision medicine, or is precision medicine the future of healthcare? That's the topic that we are discussing. So to jump right into our discussion, our panel today, for the audience to understand what is precision medicine, it somehow has a meaning to it, but scientifically, or is there any clear explanation that we can get regards to precision medicine?
Okay, I will take on that question, Thiviya.
Yeah, go ahead.
So precision medicine, when you see the word precise, it means that some sort of accurate, on target. So actually this precision medicine is a form of medical treatment that is based on the individual genetic makeup. So what precision medicine does is that they take all this information regarding genetic makeup that is unique to that person to accurately diagnose the disease and also to find the suitable treatment that work best for the patient. So this some sort of approach is the future. It's an innovative advanced approach to treat the disease. So for sure that because of this innovative advanced approach, it will improve significantly on the treatment outcome to the patient.
Right. It's precise, it's customized, and it's also the future. Right.
And then Thiviya, if I can add,
Yes, yes.
this precision medicine, right, it's not only applicable to cancer treatment. So, you know, we are now even talking about precision medicine in, you know, treating diabetes, treating other chronic diseases. But I mean, for today, we're just talking about cancer, but actually the application is, you know, throughout medicine.
Right, right. Dr. Hajar and Sayyidi, if you guys would like to add anything along the way, you know, any of the panelists, go ahead as well, right? Right. Moving on to our next discussion, right? You know, what is the relationship between when it comes to precision medicine and also cancer? I think I did a little bit of introduction in the beginning, how there's a lot of treatments for cancer, a lot of treatments that's being used, but we don't know if it's effective because different people react differently to different treatments. So what is the relationship when it comes to precision medicine and also cancer?
Okay, so before we go to this relationship between these both precision medicine and cancer, we need to know what is cancer, what causes cancer. So actually, cancer is caused by the mutation of the gene, which leads to abnormal proliferation of the cell that's formed cancer. So as of now, that like Thiviya said, we have a common conventional cancer treatment approach that available, which is surgery, chemotherapy, radiotherapy. But all this treatment is not using patient genetic profile to start the cancer treatment. Usually what doctors do is that they just do a biopsy of that specimen, cancer cell, and also imaging. Then doctor will decide which treatment is suitable for the patient. So usually the treatment model that they will use is like a try and error treatment model, meaning that everybody was treated the same way. If, for example, that I give you an example, we have two patients, patient Aisha, patient Fatima. Okay, both diagnosed with breast cancer, stage 2.
Right.
Okay? Same staging, same cancer. Okay.
All right. So I feel like I'm being thrown a quiz right now.
Yeah, it's like you want to show some of model that we're talking about. Okay. So patient Aisha has been given medication A. Okay. And patient Fatima also has been given medication A. Okay. Then patient Aisha that has been treated with medication A show a good response to the treatment, and then subsequently achieve cancer remission, meaning cancer free. Okay, it's good to patient Aisha lah. But for patient Fatima, also has been given with medication A, does not show a good response. Okay, meaning cancer is still there. Then subsequently, doctor started with medication B to patient Fatima. Okay. Even though started with medication B, cancer is still progress, and even worse, is spread to other places. So meaning the medication is not working to that patient. And then subsequently, doctor try medication C to this patient Fatima. So luckily that up to the medication C, patient show a good response and then subsequently achieve cancer remission. So for patient Fatima, she need to undergo try and error about 3 times before she found out that medication is suitable to treat her diseases. So some therapy may not work to everyone. As we all know that this chemotherapy, radiotherapy have known for their side effect. Okay, so by doing this try and error, patients suffer from unnecessary side effect. So like I want to use analogy from boxing analogy, stop punching and punching blindly. Instead, we can focus on most vulnerable point and punch it specifically or kill. So the relationship between precision medicine and cancer, by using this precision medicine, it can detect specifically what is the genetic profile for the patient by using genomic testing. And by having this information, doctor actually can decide which suitable treatment that will work best for the patient. This treatment we call targeted therapy.
All right. Right. Okay, I think that was a very clear explanation by giving 2 models.
Yeah, I can vouch that it can't be more simplified then.
Right. Right. I hope the audience understand as well. So audience, if you guys have any questions, put it in the Q&A box or the chat box. We'll be happy to take up the questions. And moving on, right, on this discussion, on this topic itself, you know, speaking about cancer itself, how specifically precision medicine help in the treatment of cancer?
Okay, so basically it's a follow-up question.
Yeah, kind of
from
follow-up.
there.
Yeah.
So definitely this precision medicine definitely help in treating cancer. But like I said before, that by having this genetic profile for the patient, it help doctor to choose specific treatment that work best for the patient. So we can avoid unnecessary trial and error, and then patient also can avoid unnecessary side effect to the patient. So of course, this targeted therapy that we call about is show much more good prognosis for to treat cancer patients. Yeah.
Okay, that's
All
good.
right.
Maybe I can echo what Dr. Faiz mentioned just now. So from the lab perspective, is a bit difficult. So you know, there's a lot of type of cancer, and there's a need a confirmation of in early diagnosis. So for example, not all lung cancer is can be treated using precision medicine. So there are several diagnoses you need to identify before you need to do the testing. So then after that, when we call it precision, is very precise. So a specific diagnosis, then you need to have a specific test to test the cancer, and then after that, you can get the mutation that very specific towards the genetic profile for each of the patient. So then after that, the treatment will be recommended from for each of the testing. So that is the relation between the precision medicine, cancer, and also the treatment.
All right, right. Thank you so much, Sayyidi and Dr. Hajar for joining in. And I think we have some questions in the chat box. I thought we can take that up before we move on with our discussion.
Sure.
And why not all insurance or Takaful company medical card covers for precision medicine?
Oh, okay. Interesting question. Thanks, Thiviya. I think I couldn't speak on behalf of all insurance or Takaful company, but Dr. Faiz and me are here on behalf of Prudential. So recently we have announced that Prudential Malaysia, PruBSN and PAMB are covering for medically necessary precision medicine. So I think for our customers can be rest assured, if unfortunately you are succumbed to cancer diagnosis, then anything that is medically necessary and then provided by the treating doctor should be covered under the medical card without any additional cost lah. So I think I can't answer for everyone, but that should be the position for Prudential.
All right. With that, I think regards to the questions, we'll come back to it a bit later. Why not? We'll just go through our discussion first. Right. Moving on to our following discussion regards to cancer and precision medicine. Do all types of cancer, like we mentioned, there's cancer treatment, there's lung cancer and breast cancer and all, right? So does all type of cancer need to undergo this method, in terms of precision medicine?
Okay. Yeah, just like I said before, thanks, Thiviya. So this is very interesting because it's very specific and it's very details, especially when you want to decide, especially the clinician also want to decide what best treatment for each type of cancer. So not because the test and treatment are very specific, then a lot of trials are ongoing. And there's a specific cancer needs to undergo this method. So my answer is not all cancer need to undergo this method. So because there's only several cancer and several subtype of cancer can undergo this method, especially like example, a lung cancer that's commonly people heard about it, even a close relative, and breast cancer. So these these two cancer need to undergo a diagnosis. So they need to know subtype. And then after that, they need to go for a method, a very specific method. So there's a lot of method to identify what genetic profile that this patient carry. So I can see lung cancer. There's like Dr. Faiz mentioned just now. So maybe this patient got this kind of genetic profile compared to another patient got genetic profile. So the treatment is different. So based on this method with a very precise lab diagnosis and testing, so based on the approved guideline worldwide, so yes, you need to, there's only specific cancer that undergo this method. So
Right.
usually, yeah.
I think Sayyidi, follow up for that question, right? Maybe you can answer together that, what are the common types of cancer, that can be treated using precision medicine? Maybe you can answer together.
Okay, sure. So for the common type of cancer, so like I mentioned just now, there are only two, but actually there's other cancer, for example, colon cancer, leukemia, lymphoma. This kind of cancer, they have very specific treatment. So breast, colon, now recently ovarian cancer. Ovarian cancer, you heard about BRCA1 and BRCA2. This is commonly, means that commonly heard, commonly you heard it before from Angelina Jolie. So yes, so now BRCA1 and BRCA2, they have very specific treatment towards the patient who have breast cancer, ovarian cancer, pancreatic cancer, and even prostate cancer. So this is very specific and very niche. So this treatment is already improved. So the patient management is better compared to what you said just now. So Thiviya and also Dr. Faiz mentioned, all based on chemotherapy. They just test everything one by one. Yeah.
Right. Thank you so much, Sayyidi, for answering that. It was very detailed. And Dr. Hajar?
Just want to add, just want to add
Yes.
to Saidi's point just now. Want to add some colors to it, Thiviya. So right now, I think the ones that we mentioned during this webinar is the one that we know. But actually, this precision medicine is evolving, and there's a lot of, researches and scientific studies being done, to see what kind of genes causing what kind of cancers. So. Once we know that, more and more, this precision medicine will explode, and will in the future there will be more and more genetic points that we know, which we can target to stop cancers, building up and expanding in the body. So I think this is one point that we want to tell everyone, that the list of cancer is expanding as we speak, and then the industry of precision medicine is also expanding right now. Yeah.
Right. Speaking about the expansion, speaking about how people are, trying out or using or getting to know this precision medicine, probably we can get to know a little bit about how or what is the process being carried out for cancer patients who are undergoing this precision medicine. An example or a model, maybe, like how Dr. Faiz explains.
Okay, I will take on that question.
Before Dr. Faiz answer the question, if you guys are hearing any thunder or rain, just excuse us. I think it's raining everywhere. So just excuse us, it's nature that we can't control. So apologies on our side. Right, Dr. Faiz, please go ahead.
Okay, so before I answer that question about the process to carry out the cancer patient, like Sayyidi said that, most common cancer to treat that, to use this kind of genetic profile is important, which is breast, lung cancer, colon cancer. But it's also important that rare type of cancer that usually hard to treat is usually persistent with all kind of chemotherapy, medication, and everything. So actually, even the rarest cancer would be benefit for this kind of genomic testing, because they can detect specifically what kind of genetic profile, and then it will be more effective to treat the disease. So it's not about common cancer, but one of the things that usually hard to treat is rare cancer, usually neuroendocrine cancer and everything. Okay, so coming back to this process to carry out patient that are undergoing precision medicine. So all these things started in hospital where the patient is diagnosed with cancer. So usually what they do is that once a patient has been diagnosed with cancer, then doctor will decide whether this patient is suitable to undergo this genomic testing, because all the genomic testing, they have a certain criteria before they need to undergo this test. Okay, then if this patient is suitable to undergo this genomic testing, then they will use a sample of cancer tissue, then they will send to lab for genomic testing. Okay, so once they have the test result with this genetic profile, then doctor will have a clearer picture which treatment is best to work to treat the patient. So like I said before, this kind of treatment we call targeted therapy. So whatever thing is this, all the treatment, all the tests is being rendered to the patient. Patient need to discuss with a treating doctor to find out which is more suitable, which is the best for their disease, so that they can recover for that disease. Yeah.
All right, all right. Thank you so much for that. And Dr. Hajar or Sayyidi, anyone want to add anything?
Okay, just want to echo what Dr. Faiz said. So yeah, in the lab, so we currently, when you say about tissue, we receive a histology tissue. So that means they send from the surgery and then confirmation sent to the lab, and we do the process. We call it histopathology. Then after that, our histopathology will diagnose based on every type of cancer. So like I mentioned just now, lung cancer, they have at least more than 5 type of cancer, subtype. So they will diagnose based on that. So with that, the clinician will definitely can identify which subtype of lung cancer can undergo for the targeted treatment or undergo for the testing. Yes.
Right. Thank you so much. Thank you so much, Sayyidi and Dr. Hajar. Moving.
I just want to reiterate, before we move on, that this precision medicine is not something that, the patient can choose, but they need to discuss with their treating doctor or oncologist, to see whether their case suits into the criteria of, precision medicine, because like Dr. Faiz has mentioned that this precision medicine or genetic test has some criteria. So the doctors need to do some evaluation to see, you would be best candidate for precision medicine. So again, go back to your oncologist and treating doctor to discuss about possibility or, option of precision medicine.
All right. Let's take one question from the audience from Yi Ting Liu. Would precision medicine, let me just read. Would precision medicine be the new practice that every doctor recommend to patients? Anyone can take,
Let me take this one. Of course, that before doctors started with precision medicine, like I said before, there is a certain criteria they need to fulfill before they need to undergo this kind of test. And of course, right now, as of now, I think most of the oncologists, most of hospital, they have this kind of approach to use this precision medicine. Maybe some of the hospital, they don't have the lab, but they can always send out to other lab to perform this kind of test. Okay, and of course, the most important thing is that they need to fulfill the criteria for the test or even the treatment to be performed. So whatever it is, the doctor is the one that decide whether this patient is suitable or not. Yeah.
So they recommend, so it's still 50-50 decision based, right?
Correct.
Right. So moving on to the next questions, right? We as Malaysian, right? We don't consider precision treatment, this medicine, as the main treatment, right? We don't consider this. And why is that? What could be the main reason we don't think this could be the first treatment that comes to our mind when it comes to cancer?
Okay, so Thiviya, so I think because generally I think awareness about precision medicine is not there yet in Malaysia. But the technology is not very new in overseas, but not considered new in Malaysia, but maybe awareness is building. So hence that's why we are having this talk today, right? To educate people, and then to
enlighten people.
Yeah, to enlighten people and to let people know that, hey, there's another option for you, in case your friends or your family member or even yourself, are unfortunately diagnosed with cancer. So at least think, and then maybe you can ask your doctor, hey doctor, is precision medicine available or suitable for me? So again, in Malaysia, like I say, I think someone also pointed out that some of the insurance company probably don't cover precision medicine yet. So it could be due to that, and for the patients to fork out their own costs to cover the expenses could be, expensive. So that's not the case for our customers. So our customers, have, as I have announced earlier, we have extended the coverage for precision medicine. So they can enjoy precision medicine if the doctor thinks they are suitable for this type of treatment. So I think this is some of the things that make people not thinking about precision medicine. But I hope in future there are more awareness, there are more knowledge about precision medicine among the common population.
Right, that's exactly what we are discussing today, is precision medicine, the future of healthcare, right? Right. Thank you so much, Dr. Hajar, for the pointers. And we also discussed earlier, right, how cancer is very expensive. The treatment cost is very high. We all are aware of it. But how well Malaysians are actually prepared for when a medical emergency emerges, such like cancer. It's unexpected, it's unfortunate. But how well Malaysians are actually prepared?
Okay, Thiviya. So I think generally people don't think about death or sickness, right? I mean, both are quite sad to think about, and
we don't want to think negatively.
We don't want to think about that, right? So one of the way to prepare for emergencies or high rising of healthcare costs in future is to have insurance or takaful protection, right? So I think 1/3 of Malaysians are not protected by some form of personal insurance. So I think it's time for us to think about future, to think about family members, and to think about ourselves. Are we able to support our family? Are we able to support the medical expenses if we are diagnosed with cancer? So awareness is still low generally, pertaining to cancer protection and cancer treatment. I hope with this webinar and maybe other partners who are doing, I think the industry is coming together to build some awareness program or activities to educate our population so that they are more well prepared in future in case there are medical emergencies or medical conditions that they have.
All right. Thank you so much, Dr. Hajar. And let's take up another question from the audience. Right. We have one from Eric Chow. Currently, the precision medicine is available from all hospitals or just certain hospitals at the moment?
Dr. Faiz?
Something
probably just need to re-explain, Dr. Faiz.
So actually, like I said before, it's available across the hospital, but of course, the technology might not be there in that hospital. Okay, but of course, doctor can always, ask other hospital or lab just to perform that kind of test so that they have that information available to the patient. So basically that, of course, all the major hospitals, they have the technology ready, but some sort of, small hospital, they don't have that kind of technology to perform this kind of test. So, but they can always send out the sample to other labs to perform the test. Yeah.
Agree. I also want to add up to that. So yeah, I can say that most of the oncologists, I can say, practice precision medicine. So you don't need, no need to have to worry about it. But the testing is maybe limited towards the lab. Yeah. So the doctor can request the testing and then send to a specific lab to who can do the testing. So when they can identify the mutation or they identify the abnormality in the genetic profile, so the treatment can be done with the doctors, the same doctor that treating the patient. So because I just want to add on, so we know that some of the treatment, they only use pill for targeted treatment. Is it correct, Dr. Faiz or Dr. Hajar?
Yeah. I think most of the, targeted therapy, they have, instead of just injection, they can just take orally. Yes. It's quite simple compared to chemotherapy. Yeah. So, and of course that this targeted therapy, of course, is available across the hospital because we have what we call local pharmaceutical company. that distribute this kind of treatment. Yeah.
All right. Thank you so much. And speaking about, I think from what Dr. Hajar was explaining, that different insurance provide, it's specific, it varies, right? Does Prudential also provide coverage that includes the method of precision medicine to customers who want to undergo this treatment?
Okay, I will take on that question. Okay, the question I think we just talked about previously, that of course, Dr. Hajar did mention a few times that Prudential did offer coverage for this kind of precision medicine, and of course the coverage is depend on the cost for clinically required genomic testing and targeted cancer treatment. Okay, this coverage also allowed doctor to prescribe clinically suitable test treatment from all panel hospital, laboratories, and also pharmaceutical company. Okay, and of course this kind of coverage for Prudential customer is automatically included into the new and existing insurance medical plan with no additional charge. There will be no repricing, there will be no add-on benefit. We just give the coverage on existing medical card. So they will benefit our patient on cancer treatment.
All right. Speaking about the plan, the coverage, and the cost a little bit. Let's take up a question from the audience. A question from Aubrey Woon. What is the average cost for precision medicine treatment? No. Simple as that. Who wants to take the question?
I'm not so sure, but I will answer based on what the lab testing, because I'm more in the lab.
Yeah.
So yeah, the testing is varies between cancer. So there's a complex cancer, there's a very difficult cancer to diagnose. There's a lot of several walkthrough you need to undergo. So especially when we call is already spread to other organ.
Yeah.
So it's not easy to identify, like from for example, from this organ which is the primary, for example. All right. So the cost is a very wide range for every type of cancer. So it can it can very specific to only one test, and it can be for example, if it's a difficult to test, it can become about 2, 3, or 4 tests. So the price difference is
it also varies.
It also varies. So it's very difficult because this cancer is very complicated. So you need to discuss with your clinician or your physician to know what is the best option for treating the patient.
Right. The name itself is precision medicine, so definitely you'll have a precise cost for each person, right?
Yeah.
Yes, yeah. Dr. Hajar.
And the cost that Sayyidi mentioned just now is just from lab perspective. So actually, there's a lot of other costs that entails into precision medicine now, because precision medicine has 2 parts. Number one is doing the genetic test itself, and by saying genetic test, there's charges of procedural, meaning taking, the sampling and all that the hospital and the doctor will charge. And the doctor will also charge professional fee on, on the reporting. So after the lab test result is received by the doctor, so someone needs to explain, right? Or someone needs to interpret and, describe it to the patient. So there might be professional fee incurred, from this activity lah. And then, of course, from sending out the genetic test, there are many local labs that can, carry out genetic tests. But in certain, for certain genetic tests, if I can mention here, if we don't have the capability, we might send out to overseas. So it might cost more lah, obviously, right? Because, it will be charged in USD or SGD. So it would be expensive lah. And then come to the second part. So if you are suitable for, some drugs, some type of drugs, you will be prescribed to the drugs, and the drugs, because it's very precise and very personalized, it will be more, a bit more expensive than the normal chemotherapy lah. But overall, Divya, I think it is, this precision medicine helps to optimize the healthcare expenses, because like Dr. Faiz mentioned way before, there are some cases where the doctor need to prescribe 2 or 3 types of drug to see whether it works for you, right? Yeah. And then there are some side effects and complications that the patient will have due to, the drug. So, you might need to pay more for, to treat complications and also to undergo, 2-3 types of drugs. So in overall, personally, I feel even though the whole precision medicine cost is a bit high, but in totality, I think it should be reasonable and quite economic actually.
Right. I think the easier way to put it is if you want to get a shoe for your customized shoe for yourself, it's people, it's the price varies as well, for different people's different charges because, it fits it fits your feet, right? So I think it's as simple as that, we can't tell exactly how much is the cost and all. All right. Let's take one question from the audience. We have a question from Faiz. Dr. Hajar mentioned about PBTB, PAMB covering precision medicine. How do we know if the cancer therapy and treatment is precision medicine? And how would PBTB, PAMB differentiate the coverage as experimental or precision medicine?
I think Dr. Faiz can take on first.
Dr. Faiz is keeping quiet.
Yeah, sure, can. So for this kind of test, whether how to differentiate, actually that's why we're working with oncologists, we're working with labs, we're working with hospital to get to know what kind of tests that are available specifically for genetic testing for cancer. So we know what kind of tests are available, what kind of criteria that are available. And of course, that what our reference we use, whether this kind of is experimental clinical trial, is that we used to have a guideline. Okay, guideline to refer to. It can be local guideline, it can be reliable international guideline. So whatever treatment that being rendered to the patient, we have some sort of reference whether this is an effective treatment, is it an experimental treatment, is it clinical trial treatment. So, but from client perspective, when doctor prescribe you some sort of this kind of treatment, you can always ask your treating doctors whether this kind of approach is commonly used in Malaysia or not. Is it really approved treatment in Malaysia or not? Because by using that medication, you need to know everything, what kind of some sort of possibility that you might have, even side effect, complication and everything. Yeah.
Right. Thank you so much, Dr. Faiz. And moving on, right, like adding on to how Prudential work with precision medicine, how does Prudential help to create awareness in handling CI?
Okay, so Thiviya, I guess that question is for me.
Yeah,
so CI, if I can just explain to the viewers, CI are critical illness. Yeah. So for Prudential, both PAMB and PBTB, we have specific critical illness coverage, which cover for up to 40 plus diseases. Sorry, puasa.
No worries.
Okay, so from time to time, PAMB and PruBSN both always, have some new innovative product relevant to the market, and we try to make the product affordable. So like for example, recently we have CI coverage for mental illness, so that's quite good. So from year to year, we always revamp the product design and all that. So so CI product is always have a what you call it, have a special place in Prudential lah. So every year we'll always come up with new product for we try lah for CI kan. So in terms of awareness of CI, right, Thiviya, I think there's a lot of activities, marketing activities that the company is doing, and especially with this today talk, we are talking about precision medicine for cancer, right? So there's a lot of talks and activities, contests, and then content sharing in our social media platform and all that to educate public and our customers about CI disease and the importance of CI product. And I think at least for Prudential, we always look for partners, like pharma company or labs and hospital providers, to join together and also promote awareness about CI and cancer awareness.
All right, all right. Thank you so much, Dr. Hajar. Let's take a question from the audience. Is genomic testing also covered by PruBSN because this is pre-treatment? Now we
Hello.
have
Yep. Yeah. Okay. So let me take that, Thiviya. So genomic testing is part of precision medicine. So
Okay.
like I mentioned just now, there are two parts to precision medicine. If I can simplify for you and the viewers, right? The number one is the genomic test. The genomic test is prerequisite because you want to know what is your genetic makeup and what caused the cancer, right? And then the second part is the targeted therapy, which can consist of chemotherapy or targeted drugs and all that to treat cancer based on your genetic makeup. So yes, medically necessary genomic tests will be covered under this precision medicine coverage.
All right, all right. Thank you. I hope that question was answered from the audience. And I think we have one last question. I think anyone can answer. You know, Dr. Faiz or Sayyidi also can take up this question. What would be your advice to the public when choosing the right critical illness plan? Oh, Dr. Hajar can take it.
Okay, probably I can start. Okay.
Yes.
So for our customers or even public, we always advise, get a good agents to serve you because everything, starts with a good agent. So if you are interested about CI product, you can speak to our agents. I think you can go to our corporate website and drop your details there and we will contact you, for consultation. Secondly, as a rule of thumb, Thiviya, this is quite popular in the industry. The amount of critical illness that you should have is 5 times your annual salary. Why we say 5 times annual salary? Because according to research, in average, you need 5 years to be completely, recover from any critical illness, for example, cancer. So that's what the research says. So that's why we always say you should have at least 5 times your annual salary so that, in that 5 years of recovery, you can focus on your health, you can focus on your family, and you can focus on yourself. You do not need to worry about, getting the, the expenses sorted out and all that in case, you sometimes, during that recovery period, you are thinking about, how do you cover for the loss of income or how do you get expenses for the medical and all that. So I think that should be the formula for you. And then, agent just now, and also, the amount of CI that you should buy. I think the rest, maybe Dr. Faiz and Sayyidi can tambah.
From my side, I think that when you choose a product, you need to know the product first. Which product that offer the most to you? Which product that cover you the most? And of course, you need to understand what kind of thing that they cover. But from Prudential, from our side, like Dr. Hajar said, that there's a lot of sharing that is done by us. I mean, it can be from our Facebook platform, can be from our our corporate website, can be from our Pulse app. It's a lot of sharing that we share about what is the critical illness that we covered and what is the thing that about that specific disease. So I think before you buy anything, you need to know what kind of product that you will buy, and then what is the extent, the coverage that they will offer to us. Yeah.
All right, all right. I think with that, we can conclude the question from me. And let's take up question from the audience. I think we have a few questions. Right, from Chi Kyonggan, if the patient undergoes such treatment, precision medicine, is it possible to inherit to next generation? Dr. Faiz?
Maybe I can answer that question. Some of the cancer, there is a possibility that you may pass out to your generation. For example, like breast cancer, BRCA mutation.
Yeah.
But for you to inherit precision medicine, I think is not the same way as you inherit the mutation. Okay, if you have this same mutation inherit to your subsequent generation, yes, the treatment might be the same. But of course, it's not only that. There is a certain criteria you need to fulfill. So precision medicine is not something that you could inherit. It depends on the individual, which individual have that certain genetic mutation. So maybe that your father have that kind of cancer, okay, have mutation A. But when you have and then you yourself have also the same cancer, but different genetic mutation. So the treatment might be different. So my answer is to that is not inherited for this kind of precision medicine.
It's customized. It's very precise.
Customized to a specific person.
And yeah, maybe I can just add up
Yes.
just to make sure I think most of the audience understand. So when we say precision medicine, yes, we can say it's a cancer treatment, a very precise treatment. Okay, but you need to understand because all these precision medicine already have a guideline, like Dr. Faiz mentioned. So locally or internationally. But some of it you need to understand. There's an early cancer and also a stage 4 cancer. So the treatment is different between one stage, early cancer stage and late cancer stage 4. So currently most of the common precision medicine is coming from the stage 4. So yes, because they want to have better patient management in terms of stage 4. But rest assured, a lot of clinical trial are moving towards early cancer. So because they can see a lot of favorable response towards the treatment, so they move toward the early cancer. But we need to follow the guideline or the data from the clinical trial before we enroll the testing to treat the patient.
Right. Thank you so much. And let's take up another question. We have one from Chloe Chin and Chia. Does Prudential provide full coverage for precision medicine treatment, or there are only partial coverage for the treatment costs? And for existing customers, do we have to change our policy or just top up to cover this precision medicine part?
Okay, so for Prudential, both PAMB and PBTB customers, there are no additional costs to cover for precision medicine. So this is one of the expansion of the medical coverage that we have on top of whatever that we have covered before. So the other TNC, for example, pre-existing waiting period, I think the agent would be more familiar with what I'm talking about. So those other TNCs are still apply. Yeah? So you can also use the cashless facility for this, so you can discuss with your agent and your hospital management to get the GL sorted out. And then just now I think I hear about partial coverage and all that, right?
Yep.
Yeah, so that would depends. I think usually it will be full coverage. Like I mentioned just now, there are two parts to precision medicine, right? The one is to know what, and the second is to treat, okay? The treat, the why, okay? So the two parts are coverable if it's medically necessary and proven. I think Sayyidi also mentioned just now that there are many things outside there, but we really need to make sure, you know, ask your doctor, ask your specialist to see whether these are experimental or these proven standard precision medicine, so that you know that whatever treatment that you are ongoing, that you are proceeding with are safe. Okay, that's the most important thing, right? And then for Prudential, if you know, you have the enough limit, sufficient limit to support your precision medicine, it should be full coverage, right? I mean, of course, there are some unique situation where, you know, it may not be full because you have exhaust your limit and things like that. I think that one, the agent is quite well versed.
All right. Adding on to that question, right, from B. Pin Tan, if the patient undergo precision medicine or precision treatment, just treat as outpatient, you know, for example. So in Prudential, the treatment bill will allow claim under outpatient cancer treatment, even if the patient has no admission at all.
Yeah, I can answer that question. Like we said before that some of the targeted therapy, they're available in pill, meaning they can just take, just buy at the pharmacy and then just take at home orally. Okay, so we have in Prudential, we have a medical benefit that we call outpatient cancer treatment benefit. So where they can, as long as they diagnose with cancer, whatever treatment that is being rendered, regardless whether inpatient or outpatient, it will be covered under that benefit. So if you just take your medication at the pharmacy and then you go back home, no need to be admitted, is it coverable? It is coverable. under that kind of benefit. But of course, the coverage is still subjected to your annual and lifetime limit.
Okay, all right, all right. And we have one question from anonymous attendee. What are your opinions on early genetic testing for precision medicine for cancer? Will this have more benefit? Maybe Sayyidi, would you like to take the question?
Yes, okay, sure. But I think I also need Dr. Hajar and Dr. Faiz support. Okay.
Yeah.
So early genetics, for example, like currently, like I mentioned just now, it's only there's a available genetic testing, for example, BRCA1 and BRCA2, that mainly for breast cancer, ovarian cancer. But this one, they have a different categorized. So when you say BRCA1, but you only currently we detect on the tissue. So there's no available trial that you can use this testing as early to stop from the cancer. So usually the doctor can, the clinician or the doctor can treat you when you have a cancer. So when you know the testing earlier, but you need to do a lot of screening. But currently the limitation of this treatment, like I mentioned just now, is mainly for you already late stage. So you need to discuss with your clinician how to treat your cancer, even though you have that genetic mutation. Okay.
Okay, I want to add on that thing.
Yeah.
I think I can explain on what we call early stage breast cancer genomic testing. I think we can talk about one of our commonest cancer, which is breast cancer. Okay, so for early stage breast cancer, if they are diagnosed with that cancer, all the patient need to undergo chemotherapy. Okay, so that is one of the tests that they can do and detect whether patient is really needed for chemotherapy or not. So by using this kind of tests, actually they can have a chance to avoid completely chemotherapy. So I mean that, like Sayyidi said, that this more clinical trial are moved toward early stage of cancer, because they don't want a patient to have unnecessary treatment is being done to them. So some sort of, they can avoid completely the treatment. Once the surgery is done, they can avoid completely chemotherapy. So it's like that, it's moving toward the early cancer stage on genomic testing. And of course, it gives much more advantage of the patient in terms of cost, and also unnecessary treatment is being done to the patient.
All right, Dr. Hajar, would you like to
so Thiviya, I just want to add that it will also depends on how early we're talking about, right? So if stage 1, stage 2, I think Dr. Faiz and Sayyidi have mentioned just now that there are some tests that are proven to be done on early stages of cancer. But just want to caution here that, there are some also tests that can be done on people who are just want to see whether I have the genetic for it or not, So for example, you have family members or you have some close relative who are diagnosed with cancer and you are worried, oh my God, do I have, the genetic? Should I be checked for it? And then you go for checking and then find out that you have genetics, or probably you don't have it. So for this kind of screening testing, we call generally is not coverable by insurance, because that should be, out of the terms and condition of the coverage. So the one that, the scope that we are talking about here is people with symptoms, people who already diagnosed with cancer, and then they had this proper staging for their cancer, stage 1, 2, 3, and 4. So for those who are just checking for, just want to know whether, what is my probability of, getting cancer and all that. So that one will be outside of coverage.
All right. Thank you so much for answering the question. Right. If there's, I think with the time constraint and all, we won't be able to take so much question from the audience, and we might need to conclude it. And if I think questions that were not answered, we'll try to get back to you, or you guys can try to get in touch with us as well. And probably to conclude the session, right, can share one key takeaway from each of you when it comes to is precision medicine the future of healthcare?
Okay, I'll start first, Thiviya. Okay.
Yeah.
So
Dr. Hajar is very excited.
So I think we had a very good discussion today, and I'm happy to see many good questions that are coming. So people are showing interest, for this topic. So that's good, and then keep on sharing this webinar or sharing this topic with your friends and your family, and get more knowledge about precision medicine. And just a bit of advice to everyone, now you know about precision medicine. So if unfortunately you are diagnosed with cancer, speak to your doctor about precision medicine and see whether this option is suitable for you. And let your clinician decide what kind of genetic testing, what kind of targeted therapy that is suitable for you. And for Prudential customers, speak to your doctor to issue, or to submit a GI request if admission is required for the precision medicine, and we should be happy to support our customer for that. Thank you.
All right, Sayyidi or Dr. Faiz?
Again, maybe I share first that I think this is a good platform for us to share some awareness about this precision medicine, because it's a new modality that available in Malaysia. And then, as we all know that cancer right now is rising prominent as one of the leading cause of death in Malaysia. So by opening this kind of coverage, it's part of our goal to help precision medicine to make it more accessible and affordable to cancer patients, so that we understand that patients have access for this kind of treatment option that available in Malaysia. So hopefully that this kind of approach that we take will help to reshape cancer treatment landscape for Malaysians to receive best advanced treatment that will benefit for the cancer patient. So I think thank you everyone by viewing this session. Hopefully that you get something by joining this webinar.
Right, Sayyidi?
Yep, sure. Okay. And yes, I just want to just to say I'm very excited. So because this is the best thing we can to share the knowledge of precision medicine. So like before, I think no one in Malaysia know about PCR, and then because of COVID, everyone know about PCR. So PCR is one of the method to do the testing for the mutation. And then after that, you heard about the genomic sequencing. So this is also a new technology that used for identify the mutation. But yes, for lab perspective, we are trying our best to adopt and also to make it accessible to all the cancer patients to do the testing and for the targeted treatment. So we will be having for Pantai premium pathology, we are going towards a lot of testing for the precision medicine, in Malaysia to support, for the cancer patient.
All right, thank you so much, Dr. Hajar, Sayyidi, and Dr. Faiz for sharing such an informative session. I think in the comments, it's like everyone is saying, such a good session, is very informative and very good knowledge and all. So thank you so much for sharing, spending your time with us. It was great. And with that, we have come to the end of the show. So very productive indeed. The comments keep on going, so I cannot concentrate on the closing also. So thank you so much. And speaking about precision medicine, how it's going to be helping us to treat cancer more precisely is indeed the discussion that we had today, and very great knowledge that all of us are taking away, including myself. So thank you so much. With that, we'll see you guys in the next session if you're joining us for the next session. And thank you so much, everyone. Good day to you all. Bye.
Hari Raya, everyone.
Oh, they say they didn't mengantuk at all. Right. Thank you, everyone. Bye.